Yes, thank you again. And this is the time of the first session about ongoing technology developments. And the first speaker we will speak about the what's coming rtx1 from Imaginize.
Thank you very much, Daniela, for the introduction. So I am Marine from Imaginize, and I am going to present about the upcoming new features for the rtx1 adaptive optics retinal camera that we have demonstrated in beta version at our booth at Arvo just 1 month ago. At Imaginize, we continuously collect feedback and improvement requests from the users of the rtx1, which is a medical device in Europe. Over the past years, we noticed a high demand for these 4 points. So imaging the RPE at the cellular scale, functional measurements on retinal vessels, acquisition protocols for facilitating clinical studies, and better integration of the mosaicism. So we have been working on solutions to answer these needs, and I'm going to show you today. So for RPE imaging, to make it possible, we developed a second illumination method for the rtx1. So this add-on you can see here on the device, it's used to send the light to the retina, but through the sclera instead of through the pupil. This enables to bypass the cone photoreceptors that hide the RPE underneath and get back reflected light from it. So on healthy eyes, it's enabled to obtain images like this one here, in which you can see individual RPE cells. They are the dark gray dots surrounding by a gray contour, and it looks like some honeycomb pattern. And these cells could be counted also. And at the 15 National Ophthalmology Centers, the use of TFI on patients in a clinical experimentation, it also showed that pigment clumping, like in this AMD case you can see here. So these dark dots that are already visible on the normal rtx1 images, they could be better visualized with the TFI acquisition mode. So with these first results from patients, which were presented by Dr. Gocho at Retinal 2021, we do believe that transscleral imaging with rtx1 will enable new explorations of the RPE and of its alterations in pathology. Now about flicker stimulation. In another clinical research project at 15 Hospital and La Riboisière Hospital in Paris, rtx1 users have experimented with flicker stimulation for assessing neurovascular coupling. This neurovascular coupling is a dilation of the retinal vessels in response to a flickering light that stimulates the neurons. So their preliminary results showed that flicker-induced dilation could be measured with micron precision with the rtx1. And so we have now integrated this type of exam in the device. So the device delivered using the internal target display. It delivers the flickering light to the eye that is imaged. So this is what the patient sees inside the device. Just in real, it flickers more fast. And also after the stimulation is launched, the acquisition of the image will start automatically. So it's fairly easy to use. And when the acquisitions are done using the EODetect software for analyzing images, it is possible and also easy to measure with micron precision the calibers of the vessels on an image without flicker and on an image with flicker stimulation at the exact same place to assess if there is dilation. So with this new exam mode, it will enable new investigations in conditions and in diseases that affect small blood vessels. The third point I want to talk to you about is the protocols. So you might already be aware of rtx1 images. The size is 4 degrees, so it's smaller than conventional images. This is why rtx1 exams usually include multiple images. So users have been asking for SOPs repeatedly. And with new image types like TFI or flicker that I just presented, this need becomes even bigger. So building on the experience of users and on published studies, we have added protocols to the software. So now when imaging a patient, instead of programming one image by one image using the buttons here, the user can just select a protocol and then now take the first image of the protocol. And when he's happy about the first image, he can just switch to the next image and the software will do everything by itself, and so on until the protocol is acquired completely. So these are just a few examples of protocols that have been included. And we can also configure custom protocols on demand. So finally, the last point is mosaicing. Making montage is already possible with the rtx1 using a third-party software, i2k. But now we are integrating completely the mosaicing in the rtx1 software itself to make the user save time. So with the new software, it will be possible to create the montage during the exam, like with each new image that is acquired, and the montage is directly updated. And then images will be stored in the database, and measurements using EODetect software will be possible directly on the montage. So you can imagine how much time can be saved thanks to these kind of integrations. So this was a brief presentation of the main new features that are coming for rtx1. They will streamline the use of adaptive optics imaging in clinical studies, longitudinal, multicentric, and enable new discoveries also. So all of this will be available at the end of this year. However, the software will be compatible only with the Windows 10 and Windows 7. So for all units running under Windows XP, upgrades to make it on Windows 10 are possible as we announced last year. And there will also be some hardware compatibility conditions for the transscleral illumination add-on and also for the flicker stimulation. So if you want more information about what the upgrade includes and how it can apply to your device, please don't hesitate to contact Imaginize. And I thank you all for your attention.
Thank you, Marine. It was an honor to introduce you, and thank you for your suggestions and for this news. And the second speaker is Kyoko Gocho from Cansvan Hospital Paris with multimodal multi-scale imaging first clinical results. Thank you.
Thank you very much for introduction. So today I'd like to present clinical cases where milling prototypes. So with milling system as multimodal and multi-scale imaging, it has a large view of images, SLO, OnFACE-OCT, and swept source OCT and OCTA. And with AO, we have AOSLO, AOCT, and AOCTA. And it is very small, compact size, and which include the pupil tracking and the retinal tracking system, and able to operate by a single clinician using a touch panel to control the system, including changing the focus. So Marine project was collaborative research and development European project with 6 partners. So I'd like to give my acknowledgement to all milling partners. So first, I'd like to show a healthy case of swept source OCT. It shows the detail of the retina, choroid, and vitreous in detail, and with adaptive optics focused on the photoreceptor layers, so we can see the individual photoreceptors and also the in between the choriocapillaries and the RPE. So it's very, and also when we focused on the more inner retina, we found the musa cell-like structures, and this is the reference image recently published by the Kyoto University team. So as pathological case of the retina with AOCT, this is a case with autosomal dominant optic atrophy. So large view of the image could allow us to find the ROI easily, and then we can find the AOSLO, show the on-face image of microcystic microedema, and the AOCT reveal the detail of MME. So this is the healthy case of the photoreceptor image by mailing AOSLO. So we can change the focusing using the touch panels. And with a special lens, so very close to the central foveal cone were also visible with mailing system. This is AOSLO image. And as a pathological case, I'd like to show the central serous choroidal retinopathy case. So when we see the CSC, very small CSC in the OCT, so then we can use AOSLO to see how it is in the photoreceptor image. And this is MD case. So we can choose the atrophy and the border area to choose where to see with the AO. And we can use AOSLO and with AO-OCT. So we can see the atrophy area, and the outside we can see still ELM and RPE, and hyperrefractive Foci was visible. So AOCT gives us the volume information. This is the early diabetic retinopathy case. So in AOSLO, we see the aneurysm, expected distribution, and the detailed information of the capillary. So we found the on-face OCT was very interesting to detect the exudate in the retina. And also AOCT, it was visible, the both sides of the aneurysm were visible in the AOCT. So we can do the follow-up to see the small difference in the very short time. This is in 1 by 1 each month. So, and we can see the new total capillary regions. And with OCTA, it was possible to separate the 3 plexes in this case. And in these plexes, we can see the many microaneurysm and a very small non-perfusion area. And with adaptive optics, OCTA, unfortunately, video didn't work. I hope it works. Yes, so we can see the the detail of the edema. And this is the combined image with the AOCT. This is the gray one is AOCT intensity and OCTA. And this is a combined angio and intensity. So in some place there was some OCTA was not detected the movement, but still the OCT intensity was detecting the small capillaries. So I think it's very interesting to see the detail. So thank you very much for your attention.
Thank you. Thank you very much, Kyoko. Excellent presentation, very interesting results and beautiful images. And I have a question for Marina and for you, Kyoto, because I think that adaptive optics could be a useful tool to evaluate also retinal vessels. We made a paper about the findings in the endothelial wall in Fabry disease, and we saw some infiltration by sphingolipids in the endothelial walls in our patients affected by Fabry disease. Do you think that this high resolution with adaptive optics on the vessel could be a useful tool, could serve as a biomarker in some diseases such as metabolic diseases, systemic diseases, or other retinal vasculopathy as diabetic retinopathy?
I think so. I think the vessel also very interesting to observe with the rtx1. There are several already publications about it. And the AOSLO image, I used it in very few cases in the hypertension case. So still we could measure it. But I think rtx1 is very nice to measure and see the small detail in the vessel diseases. This is what I think.
Thank you. And I think that the high resolution of the endothelial wall is very important to detect, and there are no other techniques that can visualize in this way the deposits or other alterations that we can see in the endothelial walls of the retinal vessel. So I think that it could be very useful tool for some kind of also systemic pathologies. We have a question from audience, and the question is, can you see ganglion cells with a Merlin?
For the ganglion cells, we haven't seen it because it's not high contrast enough with the Merlin system, because it doesn't include the other optic system. So I haven't seen it yet.
If I can add something, it's that we are aware of the results already published using averaged AOCT to visualize these cells. What we have not tried this yet with Merlin, because we aim at examinations that could be usable in the clinic, and so far the very high averaging numbers needed for distinguishing these cells means very long acquisition times that would not be possible with many patients. So we are still trying to see if we find a way that is more clinically applicable to do this kind of examination.
Okay, thank you.